Okay, so we are going to talk today about getting together, setting up your midazolam nasal rescue medication for prolonged seizure events. Before we talk about the setting up and administering and putting everything together, there's a couple things that we wanted to talk about first. First of all, you need to make sure that you have an emergency plan set up in place that tells you at what point you're supposed to administer this medication. Your neurologist and you will come together and make up this plan, and it'll be based on the types of seizures that your child has, the length and frequency, in addition to like the other medications that they take. So you need to have a seizure plan in place. If you don't, you need to schedule that and get that worked out with your neurologist right away. Another thing, if your child has the VNS implant, during this process of getting ready to administer this medication, you want to make sure that you continue to swipe the implant, and then after you've administered the medication, continue to swipe based on the time frame that your neurologist and you have come up with. Just, continue to do the swiping until the seizure stops. What I do when I get this all set up is I get it ready 2 minutes before I'm supposed to administer it. So for us, Simon's seizure rescue time is 10 minutes, and that's probably going to be different for a lot of people. But so at 8 minutes is when I pull everything out and I start getting it ready. One thing that you'll need to be prepared for based on what type of seizure your kids have, if it's complex partial or absence petit mal seizures, or the tonic-clonic seizures, your child is probably going to be fighting you while you're giving this. So if there's any way possible for you not to have to do this alone, don't do it alone. More than likely, if you're like me or some of our other moms, you will be doing it by yourself. Just be prepared that, even though their awareness is going to be compromised, they're still awake, and so they will fight. It's probably like a survival kind of thing. Okay, so this thing will come, you need 3 pieces to administer this medication. First of all, you will need the medication, which is midazolam. Our dosage comes in 5 milliliters of the medication, and they come in these pre-filled tubes like this. It says midazolam. There's 5 milliliters inside this tube. There's another way the medication can come, and it can come in these little vials that we have used before. They're really, really difficult to use, and in the moment when you're dealing with the seizure experience, this prolonged seizures, you don't want to have to mess with this. So ask your neurologist to get you the pre-filled tubes. The other part that you're going to need is the syringe. It's called a Carpuject syringe. And then the final part that you're going to need is this little atomizer thing, and it's called the MAD nasal mucosal intra something atomizer. These do not come with the prescription. You will have to purchase these separately, and you can do that through Amazon, or you can go to some medical supply websites, but my recommendation would be to check eBay first. Because you can probably get them in a bulk situation for cheaper. These are reusable. You can order a few of them and keep one at home in your purse. We have one at his dad's house, at school, daycare, have an extra one. These are not reusable. I think you could wash them if you wanted to and try to use them again, but they come to you in sterile pouches, and this is ideal, because it is going inside their nose. Okay, so you have all the pieces. Okay, so let's get started putting it together. You will take out one of the tubes out of your prescription box, and ours come 10 to a box. You're gonna twist off, there's a tamper seal, you're gonna twist it off, take the lid off, you're gonna take this out. It has a little green stopper on top. You'll take the stopper off, and now you've got just the vial itself. This is going to go inside here. This blue part you're going to twist. I put an arrow so you can see which way it's going to twist. You're going to twist it to unlock it. And you're going to withdraw the plastic stick. Then your tube is going to go inside here. And there's a little screw at the bottom. And this white stick, there's a tiny little hole that you probably can't see, but just look at it on yours. And stick the little screw inside the hole. Oh, important. This white part on here, you're going to need to push it down to break the seal. And now it's going to fit inside here. Okay, so you're going to get that in. And you're going to lock the bottom. Now it's in place. There is a way, you can turn the tube around so that you can get this clear window to show, and it's marked in little milliliter marks. You're gonna depress the stick and push the plunger until it reaches the 5 milliliters, and what it's gonna do is push all the air out. And I'm pushing. And you're gonna push it up until you get to that 5 milliliter right there. Okay, and this little thing comes in this little bag. You're just gonna rip it out and you're gonna screw it on. And you can screw it on before you put the stick in, the tube in, or you can screw it on now, it doesn't matter. It's on. And now it's ready to go. So I start this process when I have 2 minutes left before I'm supposed to give him the spray. And so if I'm not talking to a camera, I can do it really, really fast, and then I have it ready, and I'm still swiping every minute like I'm supposed to. So now it's time, it's 10 minutes, and Simon is gonna show us. I'm not gonna actually give him the medication, but you're gonna put it in his nostril, and you're gonna put in half of it, 2.5 milliliters, and then you're gonna switch sides and you're gonna put the other 2.5. The instructions that come with the spray and that are on the company's website, they use the word briskly, because ultimately you wanna push it fast enough that it mists into their nose. If you don't do it briskly, it will come out kind of liquidy, and it's gonna go down the back of their throat, which I haven't noticed causes him anything other than tasteful discomfort. So we always have a water bottle ready, and then we also have tissues ready, because afterwards he likes to blow his nose. After I've administered the spray, you have your timer going because you've been timing this whole thing. Keep swiping him, keep swiping him. When it gets to the point, if the medication hasn't stopped it, your emergency plan is going to tell you when to call 911. We have rarely had to call 911 after administering. It usually stops it pretty quickly. So one thing I want to recommend is not leaving these in your car. I have a little bag that I keep in my purse. It's about this size, and I have all 3 components not put together, but in here. This one is, I think, a little tampon bag, but it's the right size. I also have a bag that his Diastat, which was another rescue medication, came in, and I keep that in my purse. I wouldn't leave it in the glove box because it's not supposed to get past room temperature. You can, if you wanted to have one like already ready, locked and loaded and ready to go to give to the school nurse, make sure that it's in some sort of like hard container so that it doesn't get jostled around, because it's ready, and if this gets pushed down, the medication's going to come out. So it'll be wasted if anything like that happens. The other thing that my biggest suggestion is to get it ready before you need it. Don't wait till this is the moment when you're supposed to give it, and now try to get it ready. And then once you've administered it and everything has cooled down and he's resting, he's back to normal, you can breathe again, and you're getting ready to clean everything up, you have it all used. So there's nothing that says that you can't keep it, and just practice it. Practice putting it back together, show your family members, take it to the school, show the teacher, show the nurse, show them this video. But you don't have to throw it away if you want to just use it to practice, practice, practice. We have to do it a lot, so we're fairly comfortable with it. But some people are fortunate and don't have to do it all the time, so it may not be something that you're, used to doing a lot, and it may not be as comfortable for you to do. Other than that, I guess That's it. All right, thank you. Thank you for watching.
Hi, my name is Joe, and my son Tyler has what they call grand mal seizures. So his seizures are a lot different than Simon's, Tiffany's son that she was talking about. Our typical rescue time is at 5 minutes. In the grand mal seizures, it's a lot more difficult, like she said, to administer because his arms could be flailing, they could be clenched, he could be, his whole body is moving around. And so it's really hard to try to get the medicine in again if I'm alone. Unfortunately, I am alone with him a lot with my husband's career. So just again, to reiterate, know what your seizure emergency plan is, whether it's at 5 minutes or 10 minutes, and know when to call 911. And again, practicing, this is not something easy to put together. And I really don't understand why, when so many people are affected by epilepsy and seizures, that the emergency medication is so difficult. When people with an allergic reaction can just have a simple EpiPen, they take it out and there's one injection into their leg. People with diabetes have a much simpler emergency medication as well. So that's one thing that we would love to see is more research and funding for epilepsy so that we can administer these emergency medications in a much simpler fashion. Because let me tell you, when they're in a life-threatening prolonged seizure, the last thing you want to be doing is stressing out, trying to figure out how to get the medicine together. So I hope that this video, from one mom to another, or to just another caregiver, it could be a dad as well, we hope you find it helpful, and good luck to all of you. Thank you.